We're here with Dr. Padraic Obma talking about hip pain. Dr. Obma, what are some common reasons for hip pain?
Yeah, hip pain is a very common situation that people experience that hamper their quality of life. I've had my fair share of hip pain over time. It tends to break down, people think of hip arthritis, right? And hip arthritis is like bone-on-bone hip pain. And that was the only real thing that we focused on for several years. Over the last 10 years, it's become much more common for people to have cartilage tears in their hip called labrum tears. People can get hip bursitis, which is on the side of the hip, or they can get like sciatica in the back of the hip. What's become much more prominent over the last 8 or 10 years is arthroscopic hip surgery to treat hip pain before it becomes a hip replacement procedure. It's interesting because about 10 years ago now, I was having a ton of hip pain myself. And I got 3 or 4 opinions, and ultimately I settled on an arthroscopic hip surgery to preserve my hip rather than having it replaced. And 10 years on now, it's been fantastic. I don't have hip pain, and I've been very, very happy with it.
And how do you know when it's time to call the doctor?
So this is a question that I'm asked all the time, right? And I think it really boils down to, in orthopedics, a lot of times it's a quality of life situation, right? If that pain is causing you not to be able to sleep well at night, or you feel like you're not able to go out for a walk with your kids or friends or significant other, or if you're being hampered at work, these are all significant quality of life issues that probably need to be looked at a little bit further.
Why is it so important to seek help and not put off medical treatment for hip pain?
Yeah, so in my particular situation with severe hip pain for about 18 months, if I didn't go in and get checked out, I would have probably ended up with a hip replacement 2 years later. But instead, getting the appropriate treatment and intervening a little bit earlier was very important. And intervention might mean a variety of services that Prevea offers. It might mean just education on how to modify my activities. It might be getting one of our great outpatient physical therapy locations and rehabbing. It might mean getting an injection by one of the great orthopedic providers that we have. Sometimes it even requires an operation, but getting checked out early and going through all the conservative care options, hopefully before it gets to someone like myself or my partners, is really important.
And what is Prevea's philosophy when it comes to treating hip pain?
Hip pain is really challenging because it can be a lot of different things. At Prevea, we focus on very much a team approach to care for patients. We want to get to a patient early on in the process so we can have a positive impact and hopefully avoid surgery. We really want to focus on conservative care, which is taking a bunch of our different team members to optimize care for patients. That might be education, it might be physical or occupational therapy, it might be getting to one of my primary care provider partners for weight loss education, it might be getting imaging, it might be injections. There's a lot of different things short of surgery, and Prevea has a wide range of talented providers who can provide the best possible care for our patient population.
If surgery is the right treatment option, what are the common options?
And when we're talking about surgery, we generally want to look at less invasive versus more invasive. And that might be ultrasound-guided steroid injections by one of our primary care sports medicine providers. It might mean minimally invasive arthroscopic surgery where we're going with a camera and instrument to repair little tears in the hip joint. It might be repairing a muscle that was torn along the side of the hip. And sometimes it requires a hip replacement surgery if people do have bone-on-bone arthritis. What we do is so much dependent upon how it's impacting patients' quality of life, if they've gone through all the conservative care measures, and what their imaging looks like helps us to dial in to what patients might potentially require in an operation.
For a complete list of Prevea orthopedic providers in Wisconsin and for more resources, visit prevea.com/ortho.